Thank you, Deep-Rove Cloud. Thank you for your statement today, Cabinet Secretary. We all recognise that the oral health of children is particularly important, especially since dental infections in children are one of the most common chronic childhood diseases and is the main reason for the use of paediatric general anaesthetic. Poor dental health causes pain and discomfort, which can lead to difficulty in eating, speaking and sleeping. And it can also affect academic performance, not to mention someone's overall quality of life. We also know that it can result in absences, putting children under greater risk of becoming severely unwell or septic and needing hospital admission. I recognise the successes of the Design to Smile programme and the fall in prevalence and severity of tooth decay in children since 2008. I would therefore like to raise one of the major issues that dental practices still face when dealing with children. It's found that children make up a disproportionately high number of missed or failed to attend appointments, and dental practices have no mechanism to investigate why appointments have been missed other than to ring their parents. This is a widespread problem and not only wastes precious dental clinic time, but means that children are not having the care that they need. Poor dental health in children is a major sign of neglect by the parents, and it's vital that more is done to make sure children attend appointments. What is the Welsh Government doing to encourage parents to take their children to dental appointments? Given the current crisis in NHS dentistry, it is quite frankly not good enough to allow this to go on. What proposals do you have for more stricter investigation and penalties regarding those parents who repeatedly fail to take their children to appointments? Cabinet Secretary, you mentioned the dental reforms that you have made since the pandemic, and you are now proposing to undertake another major reform of NHS general dental services. As you may be well aware, this has been of great concern to the dental community, in particular because the proposals you are trying to introduce are untried and unpiloted, and you have no data or evidence to suggest that they will work. Deep-Rove Cloud, I believe, it is believed by the dental community that there will be a severe knock-on effects for children's oral health if the new system were to be introduced, which could undo some of the good work that has already been done. For example, the current system, dental practices will usually try to see a family together, or at the very least, siblings together, thus saving on travel time and helping families to make appointments. However, the new system that is being proposed will end this practice. Children from the same family most likely have appointments at different times and possibly even at different dental practices, increasing the likelihood of missed appointments. Cabinet Secretary, if the new system were introduced, how are you going to mitigate for this separation of family appointments? The new proposals will also mean that patients will be expected to travel further distances to appointments. For many, transport issues are already a major barrier to attending appointments, and it will likely hit families with young children the hardest, especially those who rely on public transport. What consideration are you going to give to the new system to allow for the fact that parents, often with more than one child, will likely have to make substantial journeys to attend appointments? As you will be aware, Cabinet Secretary, under the new system, dentists will be explicitly unable to share patient records or x-rays between practices, creating significant hurdles to maintaining personalised, consistent treatment pathways. This will not only increase the amount of time needed for each appointment, as there are likely to be duplication of record taken and repeat x-rays taken, it will also directly undermine preventative care because each dentist will not have access to previous patients' history. This will be especially problematic for vulnerable children because it will be harder for dentists to identify long-term child neglect and child abuse. It can also be problematic for dentists when dealing with children and indeed adults with neurodiverse conditions or other severe and chronic health conditions, for them to keep asking repeatedly about their patient's health, medical condition, or what medication they are currently taking. How is the Welsh Government going to ensure that those vulnerable children and those with health-related issues are not disproportionately affected by the proposed changes? Finally, Cabinet Secretary, the most deprived areas of Wales have the highest severity and highest proportion of children with tooth and gum decay, and as was mentioned earlier, we know that this affects children's health and even educational prospects long-term. Yet evidence has shown that a lot of parents still do not know or understand this link. With this in mind, what specific steps are you taking to make parents aware and keep reminding them of the importance of their children's oral health? Thank you.